So good morning. We're looking rough and scruffy this morning as I try and answer a few questions. This one says, so I have IC of the bladder, fibromyalgia, arthritis, osteoarthritis, 4 pinched nerves in my neck, dysfunctional SI joint, and I think that's about it. I think that's a lot. To say the least, I stay in chronic pain. My PCP has been giving me hydrocodone 7.5 for a day for about 10 years. I was born with the interstitial cystitis and have had fibro for greater than 10 years. Anyway, I asked him for hydrocodone 10 milligrams. He said no. Not only did he say no, he called me an addict and told me to find a pain management place. He did say he would give me a referral and send my records, but it was up to me to find the place. Up until now, me and my PCP had a great relationship. I don't understand what the difference is between 7.5 and 10 milligrams and what the big deal is and why he referred to me as an addict. I always pass my pill counts and urine screens. I'm very upset. Do I have a right to be upset? Yes, you have a right to be upset. I think maybe there were a few things that I would have done differently. Remember, I don't believe in asking for a specific pain medicine plan. I believe in stating what is and is not working, but I don't think anybody should refer to referred to as an addict. I very rarely use the term, and when I do, it's usually with a person who agrees with the term. You know what I'm saying? We have discussed, and they feel they are, so we use that as a common language. You can say that someone has substance use disorder or things like that. What I sometimes say is that patients have a more appropriate patients have a closer relationship to the medicine than they do their symptoms. But there's a lot of ways to say things in a much more respectful way than just calling them an addict. It's one of those hard stops in a conversation. The other thing is, I'm not sure that you and your PCP had a great relationship before. If he would, certainly you viewed him a lot more positively than he viewed you. And the only thing that's different now is that you brought up a situation that basically made him show his true colors. I don't like his attitude towards you. Even if I was not comfortable prescribing hydrocodone 10 milligrams 4 times a day instead of the 7.5, I would say something apologetically like, this is as high as I'm comfortable going. I would be happy to refer you to, and I might, yes, still say you needed to find the place. But the part where he just went sideways and the part where I felt like he told you that you need a new PCP is where he lowered himself to name calling. Remember, the book says, and let me pause. Well, actually, I can't pause. This is the video, but guess what? I have to open a new box. I don't have a copy of the book sitting in front of me, but you know what it looks like. You know what it looks like. The book says there's a chapter in there called how to know when you need a new PCP. What you have discovered is that you need a new PCP. You absolutely do. Whether you get a pain management provider or not, you need a new PCP. Because I would not want a PCP taking care of me who just thought I was an addict. You are more. You deserve more. The book is available at drmikesays.com. And it covers this topic completely. Okay? So if you have similar questions and you want to know what I have to say on this, the best way is to have the book in hand so that you can whip it out if you need to at a doctor's visit and say, this is what I have heard. Can you kind of comment? Don't use the book, though, to try and prove them wrong. That doesn't end the conversation well. But yes, I'm going to finish this up. You should be upset, and you need a new PCP.